Greetings, Neishloss and Fleming agents. Welcome to this newest edition of the Neishloss podcast. I'm Bill Correa. I'm jumping in today for your normal host, Mike Asti, and joined by a fellow Pittsburgher here, Kevin McGavick, the Vice President of Dual Special Needs Plan Strategies with UnitedHealthcare. Kevin, how you doing today?
Bill, I'm doing fantastic today. Thanks for having me on the show.
Yeah, absolutely. So, we're in the middle of Snowmageddon here in Pittsburgh. We've got, it's all coming down quite nicely. Which certainly is music to my ears. I don't know about you, but I cannot stand December at 35 degrees. It's just terrible. And we're finally getting a big snowfall right on top of Christmas. Am I the only one that feels good about that? Or are you also a big fan of the snow, Kevin?
I am absolutely not a big fan of the snow. My goal is to move as far south as humanly possible.
All right. Well, we can sort of agree to disagree on the snowfall, subject. But hey, let's get right into it. Really appreciate you joining me. But certainly, this has been a really challenging year, specific with the COVID-19 pandemic. From an insurance perspective, I think what we've seen is that it's even been more impactful to agents who work in the low-income market, knowing that so many of the prospecting and engagement strategies that those agents utilize are very grassroots-oriented, they're face-to-face. So understanding those challenges in this COVID environment, if we had 30 of our agents that were physically in a meeting room and you were talking with them, how would you advise them to approach prospecting in our current environment?
Now, Bill, that's been one of our most inquiries from agents that we've received over the last couple of months, really since COVID began. I think it was more of a shock in the beginning of how you adjust your business. I think more agents are comfortable in the environment now because they've made some shifts. And there's a couple of things I'm going to talk about. If I had a room full of agents, the first thing that I would mention to them is you have to make sure you're staying in constant contact with your current book of business. And the reason I say that is that's really an essential component of prospecting. Checking in with your members, making sure that they haven't had a change in eligibility, making sure that their life circumstances haven't changed, maybe recognizing a birthday. And the reason I bring this up is because you get referrals. They're at home, right? They're homebound. They're talking to their friends. They're texting to their neighbors. Maybe they're communicating out windows if they live in a senior high rise or down the hallway. And, everybody wants to make sure they have insurance now. We have seen an increased desire by low income members, particularly dual special needs members, to move off of original Medicare and get the benefits that they really want to have, or those additional benefits maybe they weren't aware of. And so you have to start with your own book of business and making sure that you're in constant contact and top of mind, so they don't just see a commercial on TV, right, which we've all seen, and then make a jump. And so I really want to make sure that I reiterate that important component. We know that the really good agents are doing that. I think there's some agents that are newer in the market that really need to concentrate, and I think that's a great way to cultivate your book, not only for AEP, but as we head into January. The second thing I would do is talk about how do you look at community events in this environment. And you're going to have to be safe, right? You're going to have to look at, you can't just go in and do a big event at a senior high rise, right? Food pantries and other social service groups are very limited touch now, right? Drive-through food pickups. But there are opportunities where we can still get our names out there. And one of those is going to be food banks, where you have a drive-through food bank. We've seen a lot of success with that. We've also seen OTC drive-through events. And what I mean by that is over-the-counter items. So, the deodorants, the vitamins, and we've actually done an event in North Carolina where we had a tremendous amount of support for people just to come and pick up those materials, not being a food bank, right? Something a little bit different. And there's a tremendous need for that out there. And then
it was interesting, just to jump in, we had seen a really neat post on social media. I think it was LinkedIn, from Rick Mute and his team up in Connecticut of doing drive-through benefit checks. They had the big UnitedHealthcare tailgate tent out there, and as the cars were rolling through, they're stopping with people, and really innovative idea, and certainly something that we've talked to our agents about in terms of trying to take an unconventional approach to prospecting to get in front of consumers. I thought that was a great idea.
You know, and he's done a fantastic job in Connecticut. It's been a great dual SNP and low income market for us. We've picked up a lot of market share. We've had a very successful AEP. And I think that thinking outside of the box by him and his team there and the agents there, I think has really been a big differentiator for us.
Yeah, for sure. And to the point that you made earlier, specific to working your book of business, I know that we've talked to agents a lot about that, and not just simply checking in. One of the things that we've talked to them about is calling those members, and as part of that membership check-in, asking them specifically, hey, have you utilized your over-the-counter benefit? You know, in some markets it's a catalog, you know, the benefit's structured differently, different places, but trying to talk to people about, hey, instead of heading out to the store, maybe use your benefit catalogs to help you keep you from going out into the public, and then asking, you know, hey, are there other people that, you know, might really like this benefit that live around you that could really take advantage of this as a way of trying to generate prospects?
Well, and Bill, I think that's I like how you package that to your agents. I think it's really important to understand how the benefits work, not just reading a spreadsheet, right? So reading a spreadsheet, you get $300 OTC on a quarterly basis, right? But at the end of the day, I like how your approach is, right? So did you use it? Because if you haven't, right, it's an availability to help you with those vitamins, additional, what I call those daily supplies that you might need. But remember, in those OTC, both a catalog, right, if you don't want to go to a store, or if you are okay going to like the senior hours or the earlier hours, or if you have to pick up a prescription, you don't have it mailed to you. What's really critical about that benefit is you can get additional items. You can get a cane, you can get walking support, you can get bathroom support, right, handicap support, you can get compression socks. And so there's, usually I tell people, if you flip back in the book a little bit or you go into other parts of the store, you'll be surprised at some of the other items that a member could be eligible to have that would help their health and wellness. And I always tell people this, in the majority of the stores that you go to on the United product, you can actually get a water pick. And so you can get blood pressure cuffs. And so those kind of items, I mean, they're clearly pretty expensive, but they're also very, something you might not think of to use the catalog for.
Yeah, absolutely. Yeah, and those are some of the things that I know that when we have conversations like this with industry experts in the dual special needs and low income market, you know, as well as talking to our agents who produce a lot of this business and are very ingrained in the communities. You know, this is the type of idea sharing that, you know, we're all trying to figure out to try to help work through this period of time. You know, so that's really good stuff. So let me ask you this. Oh, I'm sorry. Go ahead, Kevin.
Well, I was going to mention, I think you should add to your members when you're talking to your agents as you go forward. You know, one of our new benefits is a food benefit. It's a monthly food credit that you can use at a variety of retailers, depending upon what state you're in. And, you know, it's a use or lose monthly now. And so to your point, you know, getting that new card in the mail, making sure they're comfortable, they don't throw it away because they're not used to a debit card. And then making sure that they remind the member, you know, $25 to $55 in food. You know, you're talking up to 600 and change, or 550, I guess, you know, a year. That's a lot of money, right? And I want to make sure that your agents are well knowledgeable about that process and how they could talk to their members, right, and carry that additional value as an agent to them.
Yeah. Well, here's the question about that benefit. Can we get the agent sent this food so they can try it and then say to their members, hey, I just got a delivery of this stuff. It's fantastic. We should think about trying to roll that out.
Yeah, you know, so what's really interesting is ours is a healthy food benefit a member can use in store. Some of them do have an online capability, and I'll just use Walmart as a vendor with that. There is some pickup capability as well, but the real important part is it's not just sent to your house, right? So when you go pick it up, it's a variety of food categories, and it's very similar to the in Pennsylvania, it's called the WIC program. It's you know, for better lack of a word, it's called the food stamps, right? But you know, they changed the name of that to the SNAP program, and so it follows the same guidelines. Every state's a little bit different in what they accept. So they can go into the store and anything that's typically eligible for SNAP would be eligible in this program. So you can't get cigarettes and you can't get alcohol and you can't get like ice cream, but you can get the items that fall within those guidelines. So healthy meats, food. You can, and really what a lot of our members ask for are the expensive Ensure and those nutritional supplemental drinks, right? They're about, if you've seen the price on those, they're about $8 for a 4-pack in Pennsylvania. Price might differ a little bit, but you can get for $25, you can get a couple of those, maybe enough to have one every other day. And so, it's a little bit different than having food just shipped to your house, like a frozen, package to your house. You can actually go to the store and pick out what you want to get with that.
That's awesome. Although I would tell you that my daughters would dispute that ice cream is not a therapeutic food item. Certainly anytime they're having a health issue or a bad day, they'll tell me, "Daddy, it's time for ice cream." So, may need to include ice cream on the mental health benefit moving forward. Just a thought.
No, I'm totally with you. I understand your perspective.
Yeah. Well, hey, let's talk about benefits a little bit, and understandably, and specifically talking about that food benefit, obviously understanding that, the amount of dollars that are available can vary market to market, and there may be, one metro area that has a particular benefit that another does not. But, when UnitedHealthcare was putting together their dual special need plan benefits for 2020, do you feel like there was kind of a common theme? Like, here are the really important items we're trying to have in play. What was the focus in building that ancillary benefit package to really try to offer the greatest value proposition to the members who are considering your product?
I'm gonna craft that for 2021, if you don't mind, just because I think that's the season we're in right now as we go forward.
Oh, I love teasers. I love it.
Yeah. Really, Bill, what we did there is we wanted to find out what we could do to impact a member, not only in their total health and wellness, but really we call it the social determinants of health. We understand that home, right? Safety in your home, those OTC products, but the wellness of a member, right? So that's where the food comes in. And then we also did $0 RX. That means everyone in our plan doesn't pay their LIS copay. We're basically picking that up for the member. So they don't pay the $1.30. If you're a partial, it's $9.80, right? So we're picking up the coverage there. So our members have zero cost of their drugs. So we know, we've heard from a variety of surveys and feedback, prescription drug costs is one of the biggest items. And so ours is zero, all tiers, all brands. That's been one of our bigger drivers of sales and retention. And then obviously you add in food, and then you throw in an additional OTC with more retailers, being Walmart being included in that, in addition to Walgreens and some of our other independent providers. That becomes a really big draw for our members, particularly the ethnic members or somebody that wants to go to a retail store in their neighborhood.
No, that's great. Yeah, and I'll tell you what, it's been really interesting to see, Kevin, just from my perspective in terms of working with our sales agents in the field, that over the last 3 years, really, we've seen such a change as CMS kind of broadened the ability of the insurance carriers to work with ancillary benefits and put kind of more complexity into that package. Because if you dial the clock back to, when we first started working together, I don't know, heck, maybe 8 to 10 years ago when we first met, your ancillary benefit package was dental, vision, maybe hearing, maybe transportation. That was it. And now there's just a whole host of other items that are available to these members, not even just on the dual special needs plans, but on MA plans at large.
Yeah, you're totally right. And when we first started, when I go back and look at where the benefits were, I mean, we were lucky if we were able to do a comprehensive dental, right? Like it was, you were lucky if you could get fillings at the time when we first started. And that was, I started in this business 14 years ago with a small local plan here in Pennsylvania. And where we are now, that you can get full denture coverage, $4,000 to $5,000 a year. You're able to get full visions, glasses and frames at $400 or $500. Then you throw in, the full transportation, $0 RX, food benefit, $300 a quarter in catalog. All of a sudden now you have these other elements that can help these low-income members that are vulnerable, dealing with 3 or 4 chronic conditions. At the end of the day, the real key is, can we lower their cost and provide better health outcomes to them? So they, obviously save the health system dollars, and we have better health conditions for them and better for the member going forward. And that's the ultimate, that's what CMS wants, and that's what the states want.
Yeah. So let me ask you this, Kevin, specific to benefits. Do you think that, or I guess let me rephrase this. In looking at all of the ancillary benefits that are available, which one do you think you see as being the highest in terms of utilization? Is it dental? Is that really the biggest item that folks who are on a dual special needs plan are taking advantage of? Because I would think that if we look at those ancillary benefits, the item that is being utilized the most is really the one that maybe we want to be talking to prospects about most specifically, when we're presenting product for sales.
Yeah, I wish I could tell you it was dental. I mean, we really advocate the comprehensive dental, but when you think about it, the way we sell it, and it makes it sound really good, but put yourself in the shoes of a member. And if you have to go and get a couple of teeth pulled, you have to go through a series of exams for dentures, it's a painful experience, right? Sometimes you might even have 2 or 3 visits to the dentist. And so I don't want to say that that's the most utilized benefit. We do know there's a correlation of health from dental to how well your health is. So we want to see more of that. But ultimately, the members that use the most benefit is either going to be your OTC, and we anticipate the 0 RX because we're going to do it for everybody. That'll be the most, right? Every member will get that in January.
Yeah, I mean, that's a really tremendous thing. I mean, even in my conversations with agents about consumers who are on LIS, maybe they're not on full Medicaid, but they're on low income subsidy, or even that are on PACE, which is a state pharmaceutical assistance program, that it's even remarkable to sometimes to our agents that there are consumers, even at those low copays, that are struggling to pay them and sometimes aren't utilizing their medications as frequently as they should be. And certainly, eliminating the copays on those drugs for LIS consumers, I think could really drive utilization and better outcomes for those people.
Yeah, and one of the things that we looked at is, we obviously know that pharmacy is a high price, and it is hard to imagine that there are individuals that, you pay $1.90, right, $1.30 for your drugs. But, if you have 5 to 7 drugs, you're basically saving the member $8 to $10 a month, right? But that adds up, right? And then you adds up on your food and adds up in your OTC. And when a member lives on $1,000, we actually have an example of kind of a dual SNP member that lives on an income of $1,000, and really what those additional savings could do for them financially. Meaning you're going to use that money in another way, right? You're not going to displace your health. You're still going to go to and use the OTC benefit for items. You use your transportation for items. We have a gym membership and, again, an exercise regime for individuals. You do your food benefit, and now you do your out-of-pocket costs. I mean, you're looking at almost getting a full month of additional income savings for a dual eligible member. And, when you're talking $1,000 a month, you've just now stretched their budget, or maybe they can afford either some additional food, or maybe they can afford, some other items, clothes or jackets or shoes or something else for their family.
Yeah, no, I think that's a tremendous point. So let's move off of benefits for a second. Even though I know most of our agents that we work with, when they're looking at product, they're looking at line items, we try to get them to kind of focus on the beyond, but a lot of agents, that's really the starting point, is the line items. But if we push the line items to the side for a second, and you look at the UnitedHealthcare dual special needs plan, really across the country, what is it that you think is that kind of hidden element to it that's driving value proposition? Is it clinical care model? Is it something else that we don't see? Like, if you were to pull something out that you think really speaks to the values members get from that UnitedHealthcare dual special needs plan, what is that item, Kevin?
So I think it's a combination. Bill, the hardest problem we have is I don't think there's enough members that know about a dual plan and what you get on it. And let me just step back for a moment and just talk about what that opportunity is for sales agents. So there's roughly 11 million dual eligibles in the country. About 3 million are enrolled in a plan. So there's 7 million individuals that are still available to enroll. It's like there is so much opportunity. It's getting the word out there. What is the difference between original Medicare and what do you get on a dual SNP plan? And again, there's lots of benefit differences, but just dental, vision, hearing, chiropractic, not including obviously your Renew Fitness or your fitness benefit. But then you throw in your over-the-counter, your OTC, and then you put in food. You can see that it's a tremendous value story. And then the last part that I don't want to diminish is your care model, right? So we have a Navigator Care program at United. It's, every company probably has a little bit of a different program, but ours is customized at the individual based on the health assessment, right? So a lot of times our agents will complete that health assessment upon enrollment. So we start off knowing exactly what those criteria are, and then we help customize a healthcare plan for them. And part of what we're doing now is we're doing the outreach to make sure that members activate their cards. They are more aware of how they utilize and maximize their benefits, and how do they coordinate with Medicaid, right? They get Medicaid benefits, cover certain items. Dual special needs or Medicare Advantage plans covers maybe slightly different categories. How do you work that together for the best health of the member from a clinical component? So it's really a combination of making sure they know about the program from sales, right? Know about your benefits, and then how do you maximize that, and how do you get the best health outcomes from a Care Navigator program?
Yeah, it's interesting when we talk about clinical care model. Like when I can remember back, it was probably maybe 2009. We were doing some work with the EverCare team, which was kind of the precursor to Community and State. That was United's DSNP, or their special needs plan brand, for a long time. And I can remember talking with some folks down in Maryland, and we were down there on a visit. We were doing a training on the EverCare product, and ended up going out to dinner that night with Felice Bruce, who was working in that market at the time, and has been such a good colleague. And there was another gentleman who was on her team, and it kills me that I don't remember what his name was, but he was actually a licensed physician that was working on the team. And Felice and I had been talking really, and all the conversation was about line item benefits. And she said, hey, we're going to have dinner together with another person who's on our team. I really want you to get a feel for what this clinical care model is like. And so during the course of that dinner, this gentleman who was, again, a licensed MD, he was a physician working for UnitedHealthcare, talked to me and really opened my eyes to the fractured benefit system that is Medicare, A and B, and Medicaid, and how they just don't really do a great job of kind of coordinating on the member's care. And that was really eye-opening to me, trying to get a feel and starting to understand the difficulty for members to really have a cohesive plan of care in an original Medicare and Medicaid model versus on a special needs plan that really kind of pulls everything together, is trying to incorporate some sort of cohesiveness between the health plan, the doctors, the pharmacists, all of these other items, looking at their chronic health conditions. I think it was an eye-opening experience for me, and I think it's something that's really meaningful in terms of what these products offer to consumers beyond just co-pays and dollars.
Yeah, and where we've evolved from there. So we've from that group, we've done house calls where we can have an individual come to your house. Clearly with the COVID environment, that's actually become you can do some of that over the phone, but that's really interesting to have doctors come back to your house, right? Like the old-fashioned days, right? So we're seeing more of that as individuals maybe don't want to leave, or they're more homebound than they were before. But when you look at Medicaid and Medicare together, I tell sales agents, you want to take a look at who they have for Medicaid in the state, and is there an opportunity for you to enroll them on their DSNP plan? We have a lot of states across the country. I just don't have the number off the top of my head as I look at the total number of states where we offer Medicaid, and we offer an adjoining or what we call an aligned dual special needs plan. About 40% of our members are actually aligned across the country, Bill. And what's great about it for our care team, you're going to get the best care in the communication, but what our care team sees is they see all your invoices that come in for Medicaid. They see what drugs you're taking on Medicaid. They see what a doctor might have prescribed, and sometimes they'll catch where there's an error where your DSNP doctor isn't seeing what your Medicaid doctor has prescribed, and they have an opportunity to catch that because they can see it in our system. And to your point, that it isn't perfect yet, but when you have both sides, you're taking care of the member from both a Medicaid and a dual special needs side, you definitely have more line of sight into the care that member has. And if you're maximizing what they're able to get or coordinating between medicines and doctors and transportation, so the member doesn't have any issues. You can see how that improves your retention and improves your trust in the navigator that you're working with that's giving you that advice that your agent said you would have up front, right? And what's really important for us is to have what the agent has promised is delivered by what our care team and what our benefits deliver on the side once they've enrolled in the plan. And over a period of time, we've seen that as our retention has continued to, our average age of tenure continues to get longer on DSNP, and that's what agents want, right? They want to put a member onto a plan that they have comfort and trust in that's going to be there for the long haul.
Yeah, no, that's great stuff. Well, Kevin, I really appreciate you taking some time and joining me today. So last question before I let you go. You know, we were talking about how I love the snow and you wish that you could just get down south and get out of here. If I could give you a Christmas wish, and you know, it's very possible I might secretly be Santa Claus, I might be able to do that. If I could instantly transport you for the next 2 weeks out of the snow down south, where would you like for me to send you?
There's a little island, you know, on the just south of Florida. It's still in the Keys. That's where I'm going to want to go. Right, still stay in the United States and go down where it's nice and warm. Little island called Key West.
Okay, yeah, I actually spent some time in Islamorada, you know, on the way to Key West, and Islamorada is a great place. Great sport fishing down there. Not great for beaches, but you know, if you like to fish, Islamorada is your place.
I'm not much into the fish, but I do like eating fish. I just don't like to go catch it.
All right, well that sounds great, Kevin. I'll see if I can find some Christmas magic to transport you to Key West. But really appreciate you taking the time, you know, helping us reach our UnitedHealthcare agents, and you know, talking about the great value proposition with your dual special needs plan. Thank you so much.
Hey, thanks for your time. I appreciate it, and thanks for your partnership going forward.
All right, you're welcome. Thanks again. Have a great day. Thanks, guys.